Hi, this podcast is called Why We Should Check Every Newborn Baby. And this is a big subject, so if I go on quite a long time, you'll have to forgive me because it's something I lecture about a lot all over the world, actually. And it's a huge subject, and I have a great interest in it. So the first thing is someone came into me last week, and this question arises all the time with their newborn baby. This baby had no problems at all, was 2 weeks old. And the mother said, I wasn't sure. I wanted to talk to you, but I thought it would be a good idea if you check out this newborn baby. Now, actually, what tends to happen with mothers on their second, third child, they will bring the babies as a preventative. They know the story. They know what can and possibly could happen to their child in terms of colic and reflux, etc., and they want it preempted. They want to sort it out first, and that's great. But new mothers, it's their first time, they've heard something about it. They're not sure what the story is. I mean, the first thing we need to do is check the mother in pregnancy. But I'll do a whole podcast on pregnancy because there's a huge amount of different things that are involved in it, from fertility and subfertility to actually optimum fetal positionings and keeping the mother's body aligned and, the fetal blood supply as good as it can be, etc., and pre-birth positionings, which is really important. But just one simple point is there's a couple of joints in the low back called the sacroiliac joints. These are important in terms of walking and movement. They're joints between the big flat bone at the base of the spine and the rest of the pelvis. Now, their primary and most important time of when they actually move is in birth process. What happens is the baby's head comes down into the pelvic brim, and the sacrum literally moves back to create space for the baby's head to go down. So the baby's head goes down into the pelvis, engages, and is now in the birthing canal. Now, what's happening is because the sacrum's back, the coccyx, at the very base, your tailbone, is forwards. So this whole process has to go in the opposite direction to allow the baby's head to actually come out. Now, if the sacroiliac joints, these joints that afford this movement, especially at this time, are not functioning, not free, they don't have freedom of movement, which often happens and is quite common, it can lead to a difficult delivery simply because that movement isn't there in the give, and the baby can get stuck. So I like to always, if the pregnancy is absolutely perfect, the one thing I always personally advise is to come at 36 weeks so I can just make sure the sacroiliac joints are moving and the baby's head's moving into the right direction, etc., etc. Anyways, let's talk about pre-birth positionings and the optimal kind of fetal position. Babies can be lying low, lying transverse, lying breech. Each situation comes with its own different issues. For example, a baby who is lying low, whose head's engaged from 36 weeks onward, is liable to be, what happens is the skull bones are growing at the same time that they're feeling a great deal of compression. So what happens particularly is all the bones at the front of the head, the anterior vault bones, tend to be squashed, locked down, and this tends to lock up behind the nose and make a baby snuffly, and actually sometimes it can lock up the back of the bones of the palate, which can affect feeding, etc., etc. Very simple thing. If it's severe, it can make them quite irritable and have difficulty in sleeping. So if they're breached, they tend to, because of the forces upwards, their temporal bones, which the ears sit in, tend to lock up, and the pelvis tends to get squashed as well, which can make them a little bit constipated or make them prone to ear, nose, throat issues. Those are kind of the basics of that kind of stuff. So the baby's head position is really important. Now, our job is to unravel any squashes or blockages or anything that's not functioning properly. That's the simple thing about what we do. We do very gentle hands-on work to release compressions, release blocking, and any difficulties that ensue from those kinds of things. So let's talk about delivery, a normal delivery. Head down, right occiput anterior. The head is down and rotated into the pelvis and goes through a normal rotation and comes into the birth canal. Okay, there's a huge. If you think about this, there's so many factors involved here. But if, for example, if you're not fully dilated and you're induced, for example, the baby's head and crown are pushing against a non-dilated pelvis. There's a huge amount of force of compression through the head. Creates great difficulties and can squash everything up, especially the mechanics between the head and the neck. And the head and neck is particularly vulnerable for reasons I'll talk about in a little while, in terms of predisposition to colic and reflux, etc. So in a normal delivery, you've got a huge amount of forces in it. If you've experienced one or you've watched one, there's a huge amount. Just in a normal delivery, the force that the baby's head has to go through is not matched throughout their whole lives. It's incredible, and it has a huge effect on the small physiology of the baby. They go through a massive process, and when they're born, even when the shoulders can get stuck, the pelvis can get stuck, things get strained. This is a normal delivery, shoulder dystocias, etc., etc. Then the baby has to take a first breath. And now if this baby doesn't take a full and clear first breath, it can leave shock within the lungs and the heart, actually, because there's a huge switch in circulation that happens with the first breath from the fetal placental circulation to breathing in the outside air. It's a huge change. And if that baby takes the first breath, say not quite where the shoulders aren't released, or where there is a difficulty or shock and they have difficulty taking the first breath, this can lead to difficulties which we need to look at. So even in a normal delivery, there are huge forces involved. For particularly the right hand side between the head and the neck tends to get locked. There's a joint called the occipitomastoid suture which tends to lock up in a normal, perfectly pleasant delivery. Now, this area is very important because it's a vulnerable area, because some of the sheaths of the vagus nerve, which supplies the gut and a variety of things, including the gut and the gastroesophageal valve, sometimes what we can sense is that there's a little bit of a blockage there, because there's a lot of force between the head and the neck and this is a normal delivery. And this can, I think, produce difficulties and a slight kind of compression of the nerve function and a slight lower function of that nerve. And now that can have an effect on weakening the gastroesophageal valve or slowing down the gut function, because the vagal nerve supplies and supports normal gut function. This could possibly be linked to things like colic and reflux and irritability and digestive difficulties in babies. It's one of many causes, and I'll give a podcast on reflux and colic, because it's a huge subject in itself. But this is a normal delivery. What happens is the plates of the skull, the plates which are the skull vault bones, the parietal bones, the occipital bone, the frontal bones, can pass over each other. This is a normal delivery. They actually slide across each other to make the baby's head circumference less, to pass out through the vagina. This is called moulding. There is moulding that happens actually within all the bones, because the bones, when you're a tiny baby, are actually very, very fluid in their function. They're very unset, and they're actually sutures, which are joints between the bones, which are unfused because they fuse later, but all at different times. So you can get strain patterns and unresolved moulding patterns within these skull plates. This is very important because there can be left to right discrepancies in the function between the head and the neck, or there can be particular strains in bones. Now that's where we as cranial osteopaths come in. We work in very gently to release any strain patterns or blockages in these bones and allow for balance to come. Very important in terms of the development of posture later, but I'll talk about that in a little while. So I've just talked about a very simple normal delivery, okay, so far, and you can see how the baby could have had a variety of issues. The baby actually can get squashed and twisted in the neck and the shoulders and the pelvis and the hips and the legs, and the knee can sometimes get caught coming out and produce tiny strain patterns, and the ribs themselves can be slightly rotated, and these can have an effect subtly on the development of normal posture later. So it's great to check if everything's functioning. The hips are functioning, any problems with the feet, etc., which we can just resolve and unravel quite easily in most cases. Now, what happens if there's actually a difficulty in the delivery? Now, all these problems can get compounded. I mentioned before difficulties with first breath, shock, physiological. If the baby goes into distress, it can have a large effect on the nervous system. Is left in a state of high kind of anxiety. The tone is set in the nervous system in this very high way, like the baby's physiology feels like it's in survival. You can feel this. The baby is wired, cannot settle down, difficulty sleeping, irritable, crying, etc. This is, if it doesn't resolve, can actually cause difficulties ongoing, in terms of development of behavior, etc., and sleep patterns, which are, hugely vital for the entire family. So a lot of our day we spend releasing shock from distressed and difficult deliveries. In complicated deliveries, there are often there's often mechanical devices applied, like Ventouse, Hoover, vacuum deliveries, or Kiwi forceps, etc. So you're using strong forces to pull the baby out. Now, when they're used with skill, which they often are, it's more of a guiding. But sometimes, frankly, the baby's in distress and they have to be pulled out. And there's a huge strain that's left within the bones, and the bones are molded and shaped, even though they usually, and bruised, they normally recover in terms of the way they look within a couple of days, but often the membranes which are underneath the bones still show these strain patterns, and these membranes are very important because they sit on top of the nervous system, and certain nerves can pass through them that can irritate certain areas, like, for example, the gut. So you can have these unresolved, because actually babies have an incredible ability to unmold. You see a baby whose head is in a terrible shape, and incredibly bruised, but within a few days it's resolved beautifully and they're completely fine. We come in when these forces aren't resolved properly, when there's something left, where there's shock left, where there's an issue left, or even in worse cases when there's actually shock and damage, when we spend a lot of time with children who have neurological difficulties from very, very traumatic deliveries, where they stop breathing and there's lack of blood supply, and they develop things like cerebral palsy. But when we spend a lot of time treating young children who've had that disorder, to minimize using the maximum, releasing basically anything that feels blocked, and the nervous system can feel locked down, and all the plates and the membranes are very tight, and all we do is free them up, which maximizes potential plasticity of the nervous system. To what effects, who knows? It could help a little bit, or it can help a lot, but it's got to be helpful to free up blocks. That's where I really come from with this, and it seems to be. So any issue that's around, so for example, if there's an infection or any process in and around the birth that can lead to some sort of weakness. For example, if you've got a child who very early on has some degree of, say, a virus, say bronchiolitis, that tends to leave a localized area in the lungs, which feels tight and fibrous. It feels like the lung fields and the alveoli are all locked down in that area. In my experience, that can actually lead to things like asthma developing. So again, we're just freeing up blocks. Anything that's blocked, we release as much as we can. And the great thing about babies is they have a wonderful degree of fluidity and an ability to rebalance and an ability to reheal themselves. Because these formative forces that form them are still working in them. And so their ability to heal is the right word, is profound. And all we do is support that natural process that's happening within the child, or anything that's unresolved, we can support using gentle hands-on techniques, and it seems to be greatly helpful. So this is a little introduction. I could talk all day about it, but I hope you begin to get an understanding of why we would want to check all babies, because there are all sorts of things that can cause problems. For example, colic and reflux tend not to present until you're 3.5 weeks old. who knows why that? There's a complicated reason why that possibly happens. But if we can preempt any particular causative factors that could be there that we can try and help, now we can't help everything, but there are some things that we can. There are some blockages we can unblock. There is some support we can help with. For example, in reflux, the gastroesophageal valve is made up of the diaphragm, which is the big muscle of breathing. Sometimes that can be twisted, that muscle, in the birth process. It's normal. There's strains. If the lower ribs are strained, the diaphragm is attached to them. So if we rebalance the diaphragm, it may be of some help. So there's this basic kind of structural biomechanical reasons why we would want to be looking at this, especially in terms of the development of posture. I'll do a big podcast on the development of posture and scoliosis in children and checking children very soon. Anyway, that's an introduction. I wish you well.